FDA C trial, which was, so I started doing that in 2000, 2001. But over the year before I left, and certainly this past year, what we find is that, at least what I found, considering that my practice was predominantly mixed, was that I started seeing a lot more bands, patients coming in for the band. Because of the safety profile, maybe it's because of the direct-to-consumer advertisements you've seen on TV, but our practice is about 90-95% bands right now. So what the band can do for you is get rid of the hunger, makes you eat a lot less, you feel full faster, and this behavior modification is just a nice way of saying you get chest pain and you throw up, and no one really likes to do that. With so this is just a summary though. You can see weight loss up to 3 years with the gastric band before it kind of levels off. With a bypass, usually the weight loss, the most of it occurs in the first year, but it can still occur in the first and second year. With a bypass, we want you to wait until you're about 12 to 18 months out from bypass. We say the same for the band, about 12 months, only because we want to maximize weight loss, but we have patients that are pregnant right now. Someone called me, they're 2 months out from surgery and they're pregnant. So it's fine, they can, everything's healed up enough that they can have a baby and be fine. Weight loss with the sleeve does also occur in the first year again. Someone in the middle had a question?
Yeah, I just wanted to check the vomiting. I heard that after having a hot band that you will vomit every single day.
No, it really depends on the person. It depends on how tight you are. There are some people that like to be pretty restricted, but they're still, if you're in the midst of doing something and you've got 3 things, everybody's multitasking nowadays, nobody's just focused on one thing, certainly not on chewing, so we're all, you're doing all these things, you throw something down, and you might have thrown it down because you have a comfort level because it went down the day before, may not go down. You can't be on the phone, and on your computer, and, doing something else and then trying to eat. It's just not going to work out. There are patients of mine that have never thrown up. Not a lot. I just saw, that's partly why I was late. I had so much follow-up today. But, I had somebody who said, if I throw up maybe once or twice a month, that's a lot. But then I've seen other people who are like, I've been throwing up every meal. I'm like, okay, we can take some fluid out. So these things can be adjusted. It's not like you have to live with that. That's just the way it's going to be. In the back?
Yes. So the band that you get rid of, that's the actual solid band?
Yes. That's not the actual band.
One question about the band. Is it the lumbar passage, which is the tube where you get the saline? Is that something that you can feel?
Well, if you push hard on your belly, I can feel it because I'm going to do the adjustment. But if you push hard on your belly, you should be able to feel it. You certainly, it's anchored to your muscles, so if you're twisting or lifting, there are times when you'll feel it more than others. And you may not actually feel the port, but you feel a twinge.
Is there a lot of pain?
Pain?
Afterwards, you have pain?
Pain, well, with any surgery, you're going to have some pain at the sites where we cut you, but usually with the banding, it's where the port is. With the bypass, it's the biggest incision where I have to pass a stapler through. Those will hurt you, but they get better. So you should not be living in pain, though, from the surgery, unless there's a problem, which is what then the follow-up is about.
Now, what about the erosion? How does that occur? Erosion?
It's just, we don't actually know how it occurs. It happens about 1 in 500, and I think with this newer bands, it's going to occur maybe 1 in 1,000. And we don't know who it's going to occur in or why. We just know how to find it. And when it does, we know we have to do it. Yes?
So let's say you got into a car accident and the surgery decides to do it. What happens? What's the worst case scenario?
You're going to get a bruise over that. I had somebody who came in today who's apparently doing some kind of, I forgot what he called it, some kind of multi-taekwondo, it's like multi-martial art, like a mixed martial art, like exercise program. And he came in, his arms are all bruised, he's got this huge bruise on his elbow, and he's like, yeah, you should see the bruise that I got from the kick on my belly. So he got a direct hit to the port site, and there's just a small bruise there. So in general, it's going to cause some bruising, you might have some pain. The worst case is that you can actually pull off some of the sutures that hold it in place so that it's tipped, and we'd have to push it back down and suture it again. That's an outpatient procedure.
But what affects the